October being a Breast Cancer Awareness Month, we welcome you all in our today's exclusive interview on breast cancer awareness and prevention. Today, for this exclusive interview, we have one of the eminent senior medical oncologist, Dr. S.V.S.S. Prasad, working as a senior consultant medical oncologist at Apollo Hospitals, Hyderabad. He is the first in India to be qualified in both pediatrics and medical oncology. He holds membership of several reputed bodies, namely Organizing Committee IRA, Indian Rheumatology Association, Indian Academy of Pediatrics IAP, Indian Society of Oncology ISO, Indian Society of Pediatrics Oncology, and European Society of Medical Oncology ESMO. We welcome you, Doctor, for this exclusive interview and thanks for sharing your valuable time with us today. What is breast cancer?
Cancer is unlimited or uncontrolled multiplication of cells, and thereby, with that uncontrolled multiplication, it forms a lump. And such a lump which occurs in the breast is breast cancer. It is most often seen in females. Very rarely, it can also occur in the male breast, but it needs a certain amount of fat and tissue, and so it is very common in the females. And so we identify breast cancer with females. Not all lumps in the breast are breast cancer. About one or two in 10 cases will generally turn out to be cancer. So a woman should not panic whenever she finds a lump. Uh, Lump is a mass. She should go to the doctor early, and then a diagnosis can be made. And most often, as I said, 8 out of 10 times, it may turn out to be a benign lump, which is not a cancer.
What are the risk factors of breast cancer?
Generally speaking, obesity uh, with a dietary indiscrepancy in the form of a fat filled diet, say more of a non-vegetarian diet, which will in fact lead to obesity, uh, and a higher socioeconomic strata, people who tend to have this more fat in their diet, uh, is a strong risk factor. Secondly, a woman who delays childbirth, delayed marriage or a delayed childbirth for that matter, and then uh, avoids breastfeeding or does breastfeeding for a very short time, that is less than a year. These are the individuals who can get breast cancer. And of course, about in 5 to 10% of the cases, it can have a family history bearing. That means one of the family members, especially the first degree family members we call, like a mother, a sister, or an aunt, or a grandmother in the family, if they are affected with breast cancer, that itself forms a risk factor for this particular individual. And then, if the female has a breast cancer in one breast, then the opposite breast can also have breast cancer. So that itself is a risk factor. And then commonly people talk about oral contraceptive pills used for various reasons, and those are suspected to have breast cancer, but not yet strongly proven. But yes, as long as possible, one should avoid oral contraceptive pills. These are all the risk factors of breast cancer commonly.
What are the myths of breast cancer?
One of the common myths that individuals have is they need a family history for having breast cancer. Uh, it is not true. Actually, only about 5 to 10% of the patients will have a family history. The rest, 90% of the cases, do not have a family history. And so one should not feel that it's not there in my family and so I would not get it. That's not the way. So 90% of the females in the general population are susceptible to breast cancer, whether there is a strong risk factor or not. So they should be aware. Another thing which commonly people feel is if they add too much of sugar in their diet, too much sugar consumption can lead to breast cancer, is the feeling. It is not so. Sugar is not proven to be related to occurrence of cancer, and so it doesn't have a bearing. Then many females tend to keep their cell phone in their bra, and they have a feeling that it can cause breast cancer. That is not so. Um, Studies are going on from time to time whether cell phone can lead to any such problems, but it has not been proven. Then there is a myth that breast cancer can occur only in the middle-aged or older age group. It's not so. Even young females can get. So we have seen patients who are 18, 20 years also, and we have seen patients who are 80 years also. So it occurs in all age groups. So all women have to be careful. Yes, of course, it occurs more often in the middle aged and about in the 60s, but um, extremes of age is no exception for breast cancer. Mm, I think these are some of the uh, myths that are prevalent, and one should only be cautious, alert, and understand how to identify a breast cancer or a breast lump, and then come to a doctor promptly. Some of them even think that early breast cancer doesn't occur. That's rare is one of the myths, and that all breast cancers are generally advanced. No, it's not so. If um, they detect early, I mean, if somebody is very conscious and they approach the doctor in time and can get detected, the breast cancer can get detected very early, and in fact, curative treatment can be done, and um, they can lead a normal life. So one should not have that myth in their mind.
What symptoms should she look for?
The first symptom which commonly brings a female to the doctor is a lump in the breast. Okay, so that of course is the main symptom, and we can divide the uh, symptoms into the various areas. Like in the breast itself is a lump, as I said. The skin can get puckered, and then there can be a change in the contour of the breast, because the female would be knowing what her contour is. The contour is different in different females, and so each female would be aware of her breast contours because she would be seeing them. And so if there is a change in the contour, that is important. And then there can be an ulcer. That of course is a late stage uh, in the breast. Then we have the nipple. So there can be a rash, a redness, and a rash in the nipple. And sometimes the nipple can get indrawn, it can get puckered, the shape is distorted, and sometimes there can be an ulcer in the nipple also. Ulcer is even in the nipple is a later stage, and sometimes there can be a discharge, a bloody discharge from the nipple. Then we have the armpit. Now, as the days go by and as the cancer advances, there can be a lump in the armpit also, a swelling kind of thing seen in the armpit, especially when the individual raises her hand, and that is because the lymph nodal enlargement occurs in the armpit. And then finally, we have the arm. On the side of the breast, whichever arm, the hand and the arm is what it is, can all get swollen up. And so that is called lymphedema. That is a later stage, of course, but that also can be a symptom of the breast cancer.
How can she lower her risk of developing breast cancer?
If we keep the risk factors in mind, avoiding those risk factors, especially like an individual should be uh, bearing a child. So for that, in our country, of course, a marriage is important, and so a timely marriage and an early pregnancy, uh, if possible, before 25 years of age, and better uh, less than 30 years, not beyond 30 years, they should have a child. And then the child should be breastfed. Breastfeeding is the most important, and the breastfeeding should go on for at least a year, and that would lower her risk enormously in a female. Secondly, of course, they should have a good dietary schedule, avoid fat foods, avoid more of non-vegetarian diet, and avoid obesity. So these are the two things. And if there is an individual in the family who was affected with breast cancer, especially a mother, a sister, or an aunt or a grandmother, then these are all first degree relatives. So there can be a higher chances of breast cancer in the individual. She should become alert as soon as she is 35 years to 40 years of age. She should become more alert, try to do mammography, checking herself through breast self-examination and so on, so that she can identify any breast cancer occurrence very early and take appropriate action in time so that she can be cured.
What are the new screening guidelines for breast cancer?
The recent guidelines are around 4 to 5 years old by the American Cancer Society. Any individual, any female who is more than 45 years of age should get a regular mammogram done every once in a year. And if an individual is more than 55 years of age, the mammogram can be done once in 2 years. Now, the question comes for 40 to 44 or 45 years of age, where the individual, if there is a higher risk like a family history or any kind of obesity or whatever risk, increased risk is suspected, and the individual feels more comfortable by getting a screening done, it can be offered to the age group of 40 to 44. So, one important screening mechanism is the mammography. In fact, it is the only screening mechanism, I should say. Then there is a discussion whether the doctor should check the individuals regularly. Well, more than that, the individual herself should do a breast self-examination, and whenever she detects, she should go to the doctor. So, but as a screening procedure, this is not really recommended that the doctor should see so many females in a periodical fashion. So that is not there. And then if there is a family history, and nowadays we have this genetic mutation called BRCA1 and BRCA2 mutation analysis. If somebody in the family has been detected to have breast cancer, or for any other cancer, if they have been detected with this, even sometimes a prostate cancer male in the family has a BRCA1 bar 2 mutation, or another female who has an ovarian cancer in the family, if there is a BRCA1 bar 2 mutation detected for her sake, then the individual who is keen on knowing whether breast cancer is occurring or not should be uh, ready to go through the same BRCA1 bar 2 mutation herself and see whether she is more susceptible to breast cancer. It is not really a screening method, but in fact, it is another method of trying to be alert and conscious, and so that anything, if it is there, can be detected early. So as a mass screening procedure, it's only the mammography, but that is not still a screening procedure practiced in India. It's the American Cancer Society which does it. So in India, if any individual is keen on knowing whether she is likely to develop breast cancer, she has to go and get herself screened. So it's an individual screening by herself, not by the governmental or any other agency. And they will have to go and get this mammography done. So to repeat, more than 45 years of age, every once in a year, mammography. More than 55 years of age, once in 2 years, mammography. 40 to 45 years or 44 years of age, it is the individual who is likely to be at a higher risk. That is the screening recommended.
What is BSc and why is it essential?
BSc is breast self-examination, and all females, especially who are more than 35 to 40 years of age, should do a breast self-examination. Um, what it means is the female, say, uh, during the menstrual age before menopause, they should be standing in front of the mirror naked 1 week after uh, a menstrual period, and then see whether there is any change in the contour of the breast, because change in the contour of the breast can be an early symptom of breast cancer. And so that is one. Also, at the same time, not just the contour, they have to see whether the nipples are directed in the same way, whether their shape is the same way, whether there is any indrawing of the nipple, whether there is any ulceration, those kind of things they have to see. Now, once they have seen in the mirror themselves, then they should start palpation with their own hands. So they will keep one hand say, supposing they want to examine the right side, they should keep the right, they should lie down on a couch, or a cot for that matter, and put their rest their palm under the head, that sided palm under the head, and with the opposite hand and with the three middle fingers, the soft part of the middle fingers, they should palpate the breast in a clockwise fashion, just as the clock hands move in the same in that direction. Depending on the size of the breast, they have to make two or three such circles in the breast so that all the areas are covered. Finally, coming to the nipple area and see whether there is any lump which is palpable. Okay, the exercise, they should lift the breast and also see underneath the breast if there is any such lump. So this whole exercise should extend right from the clavicle to say 2 or 3 centimeters below the breast area. And once they finish this examination, they can turn to the opposite side and then see under the axilla and also on the lower axilla area, which is where the tail of the breast is. So all the areas, for that matter, are covered by this palpation to see for any lumps, and those are to be brought to the notice of the doctor. And once they do one side, the other side of the exercise has to be repeated in the same fashion. So this is called breast self-examination, and uh, one can easily learn it, and it can also be learned from a doctor or a paramedical person who has been trained in that. And this breast self-examination is a very key procedure, for that matter, for an individual to identify a breast cancer very early. And well, in fact, there is always a debate whether that can be used as a screening procedure, but then it involves a medical person to do the thing, so that has not been accepted as a screening procedure. But an individual, for her own care, can should in fact, not just can, should undertake breast self-examination regularly, periodically. And if the individual is post menopausal age, that means has attained menopause, then she can do it every month, beginning of every month, so once in a month really matter. For an individual who is menstruating, it's also similarly once in a month roughly. So once in a month, the individual should examine herself in the manner that I just described, and that is called breast self-examination. It helps in detecting a breast cancer early. Once you detect a breast cancer early, you can treat it well. In fact, we can cure the breast cancer. 99%, 95% to 99% of breast cancers can be cured if they are detected early. So that is the purpose of doing a breast self-examination.
What are the general treatments?
Treatment of breast cancer is of three types. In fact, in oncology, we have the surgical oncology, the medical oncology, and the radiation oncology. These are the three branches with which we treat cancers. And in breast cancer, uh, one or two or all three of the modalities are generally used. In fact, in most cases, all three modalities are used for treatment. Now, when an individual is diagnosed with breast cancer, and if the breast lump is in a limited area, or that it has not spread to the other parts of the body, then, and if even in the local area it is less than say 5 centimeters in size and is easily movable and operable, then operation, that is through surgery, the lump is removed. Sometimes, of course, it is either an entire breast is removed or only just the lump is removed, depending on the operability and depending on the surgeon and the patient's wishes also. If they, most females, of course, nowadays uh, want conservation of the breast, and whether they conserve the breast and only remove the lump or entire breast is removed, the results of the curative results are the same. And so that is, surgery is one of the main parts. Of course, during surgery, they will also look at the axillary lymph nodes, and there is something called sentinel node biopsy. So they'll only take one sample lymph node and then get an idea of whether the lymph nodes are other lymph nodes are involved or not. And so that the treatment can be better tailored, whether chemotherapy will be needed. If lymph nodes are involved, generally chemotherapy, that is the medical oncology part, will be needed. So that is one branch. Now, once this surgical treatment is done, then of course there is a second part of the surgical treatment where they may need a prosthesis for maintaining the contour of the breast or for cosmetic purposes. That of course is the second part. Sometimes both are clubbed, which is called as oncoplastic surgery. So this is the one part of breast cancer treatment. Once the surgery is done, the histopathologically, the characters of the breast lump, how deep it has gone and where all it has gone, whether the lymph nodes are have the breast cancer or not, that is whether it has spread to the lymph nodes or not, will be seen, and then further treatment modalities will be planned. Then, if the tumor, say if the breast lump is more than 5 centimeters or there are lymph nodes involved, then we give what is called as a local radiation to eradicate any local disease or to prevent recurrence in the local area. Okay, and there is another arm called chemotherapy. Now, the chemotherapy is to prevent some cancer cells could be circulating in the blood or in the tissues, and so to eradicate all the breast cancer in the circulation, the chemotherapy will help. So generally about say 6 cycles of chemotherapy will be done. Nowadays, of course, there is some targeted treatments in the chemotherapy part where certain breast tumors have certain characters like ERPR positivity, HER2 new positivity. So if they are HER2 new positive, then we have to use a drug called trastuzumab. So these are all, of course, the developments, latest developments which are happening, which are improving the survivals of these breast cancer patients. So surgery, medical treatment, and a radiation treatment, all three are the general approaches to a breast cancer treatment.
Can breast cancer be prevented?
As I was telling in my talk in many of the earlier issues, uh, important thing in prevention of breast cancer is for the female to get married in time and to have a childbirth in time, say um, ideally less than 25 years or at best less than 30 years of age, and then breastfeed the child and breastfeed the child for at least 1 year. And so you have more children, more breastfeeding, less the risk of breast cancer. So that is how one important way, that is, we go with the nature. So though it's a little bit of philosophical way of telling, if you go with the nature, there is less danger. So the nature has built the human body in such a way that there is a procreation to till 30, 35 years of age, and then other things in life. So if we go against that and delay things, and then we avoid breastfeeding for various reasons like being in a job or cosmetic reasons and so on, then breast cancer incidence can be more. Then avoiding oral contraceptives, unnecessary use of oral contraceptives for both for childbirth prevention as well as for other reasons is not advisable. And then the most important thing is having a good uh, dietary schedule and lifestyle, we call lifestyle changes. So, wherein you have more of fat free diet, avoid obesity, good exercise. So, these are all the things which can help prevent breast cancer. Lastly, of course, we can, if we have a genetic BRCA1, BRCA2 mutation in anyone in the family who has a breast cancer or any other cancer, either a male or a female, then if we also get the same BRCA1 or 2 mutation analysis done, we will understand whether we are at greater risk and then be more alert, undergo screening, say screening mammography more often as prescribed, say once in a year, and then do breast self-examination regularly. Then we can detect breast cancer occurrence very early. And when early breast cancer is detected and treated properly, it ends up in a cure. And that's how it is also called a prevention in a different sense. So these are all the methods in which you can prevent breast cancer.
Thank you so much, Doctor, for upgrading us with such valuable knowledge and surely be help in spreading awareness for breast cancer and will surely make women aware about early detection of breast cancer.